I'm Ruth Holman. I'm the consultant in sectional reproductive health for NHS Ayrshire and Arran. I've been in post for 16 years. When I joined the service, it was a good service, it was well respected, but we realised fairly early on that changes were going to be needed because patient needs were changing and we had to adapt. The process had been started by my predecessor, Dr. Merchant, who'd integrated the two parts of the service, family planning and GUM, at a managerial level, but we needed to work on integrating it at a clinical level. There were several drivers for change, but the biggest one I think was the 2005 sexual health strategy, which the government introduced, and that's continued, and there's been various other HIS standards and other drivers, policy drivers that have come along. One of the great advantages for the sexual health strategy was that some money came with it, so we had to look at how we would use that. And another significant change was that we were able to work in collaboration with other boards in terms of sharing information, sharing best practice, discussing how we would respond to these drivers, and a very strong network has built up across Scotland, which was, for me personally, was a great support. As a leader in the department, I recognised that change was necessary, and you always hope it will be a straightforward process. Although I have to say at the time I had quite a negative frame of mind, and that was one of the learning things for me, was how important self-leadership is, and looking at my own attitudes and what had to change there. And you can't expect other people to change without being prepared to change yourself. We had certain principles, and at the centre of this was the patient journey, trying to make things better for the patients, and that really was a guiding principle for us. The guiding principles when we were looking at change were to improve patient access, to smooth the patient journey, to really put the patient at the centre of what we were trying to achieve. But an important part of that was looking at making best use of our resources, particularly the staff with the skill mix, the physical resources, whether it was buildings, equipment, and also making the best use of our time. So if we think of transformation as a journey, going along a road, I'd say that the road was very winding, very twisty, very rough, bumpy. Sometimes you'd be driving along, seemed to be a big cliff ahead. You think, how are we going to get around this? But then you'd find the road that took you off to the side, and we found a solution to whatever it was. It was probably a bit of an uphill road, but when you look back, you can see all the twists and turns, but we definitely made progress. So thinking about what have been the big differences since we started, I think the biggest change I think has been in the nursing staff who've been upskilled to be independent practitioners, so they can now prescribe, they can undertake procedures. And this means that they can see patients independently, so we now have drop-in clinics which are led by nurses. Much smoother journey for the patient. They're seen by the first person that they meet, and that's their visit is all done with one person. We've embraced the use of technology so that for example, you can ring up to get your results on the phone, and it's a machine that gives you the results, which has freed up staff time rather than having to answer the phone and give out the results. The results line's open 24 hours. There's been a change in the environment that we work in. We've had two purpose-built buildings, which means we can make much better use of the space and are much more flexible about the way we run our clinics, which we'll use to the patient advantage. Altogether, I think these changes have brought about a real emphasis on co-production of health with the patients. We probably wouldn't have called it that until we heard that phrase, but the idea that you work together to find the solution to your need, whether through prevention and education, and particularly thinking about contraception, for example, finding the method that suits the woman, that will suit her the best, not the one that we think maybe would suit her the best. So what have been the benefits? Well, I think for the patients, they're very happy with the service. When we do patient surveys, they're getting to see the people that they want at a time that they want to see them. I think the staff have got more fulfilling jobs because they're more rewarding activities for them. I think for the wider organisation, I think we're able to collaborate with, for example, primary care and also secondary care, so that we're helping the GPs with maybe more complex problems or providing access when patients would prefer to see us, giving patients a choice. I think for the wider organisation, for example, we took on the sterilisation counselling, which freed up appointments in gynaecology for them to see other problems. And we've done this without an increase in budget largely, so by making efficient use of our resources, we're able to see more patients but within the same budget. We haven't made these changes on our own. The staff have worked well together, but we've worked with lots of other people much more widely, and we're very grateful to them all the people that have collaborated with us, both within Ayrshire and wider within Scotland. So the journey doesn't end, the road goes on and on. There's big challenges ahead, particularly for us with budgetary pressures, and also thinking about how we reach people with particular sexual health needs that don't access services at the moment. And if anybody has got the answer, I'd like to discuss it with you.